I've already broken the mic. Aha. Is that okay? Yeah. Testing, testing. Okay. Okay. Testing. Okay. I do this all the time. Hi, everyone. Zoom friends. I'm delighted to be here today to introduce two authors who've written such an important book, In COVID's Wake, How Our Politics Failed Us. It does what all our books aspire to, changing the conversations that change the world. For what period of time, besides the past 5 years since the COVID lockdowns began, has been so consequential, with such far-reaching consequences, and, until their book, so little inquiry into whether what was done is what ought to have been done. I'll let them lay out their key arguments in just a moment. But think back to that time, especially before the vaccine was ready. Think about the lockdowns, the school closures, playgrounds closed, masking, distancing, even outside. Consider the widely held perception that one side followed the science. Now, unless you've read the book, prepare for your beliefs to be shattered. And it's not just important to get the record right for the history books, though that's important too. It's because when, not if, the next pandemic happens, we need to know, have we learned the right lessons? Just a few examples from the enormous and steady stream of publicity. The authors have accepted every interview from the tiniest local station in Rhode Island to some of the biggest audiences in the world. Host of the New York Times The Daily Podcast, Michael Barbaro, was so impressed by their core ideas that they were the first experts interviewed who didn't either work for the Times or were newsmakers themselves. He called the book an invitation to have a reckoning. And that word, reckoning, was also how CNN's Jake Tapper put it on his show. In COVID's Wake has also drawn praise from The New Yorker, The Wall Street Journal, The Boston Globe, and Fareed Zakaria, and I could go on. And unusually for a book so focused on American politics, it was also featured in The Telegraph on its UK publicity date. Stephen Macedo is the Lawrence S. Rockefeller Professor of Politics and the University Center for Human Values at Princeton University. He's also the author of Just Married, Same-Sex Couples, Monogamy and the Future of Marriage, the first book I worked on at Princeton. Frances Lee is a professor of politics and public affairs at Princeton University. She's also the author of Insecure Majorities, Congress and the Perpetual Campaign. Steve and Frances, welcome.
Thank you, James, and thanks to the press for doing the book. We really appreciate it. We had some doubts for a while, but we know it's controversial, so we very much appreciate you doing it. We've loved the production process and the entire editing process. Thanks to Rob Tempia, who's not here, but perhaps listening in or will, and thanks to James and Christy and the whole team. It's been a wonderful experience for us, so thank you. So I'm going to talk for a little bit, then Frances is going to talk for a little bit, and then I'll come back. What's the book about? The COVID pandemic, obviously, but you know, the large themes are what it revealed and contributed to the degraded state of liberal democracy, and we really mean the degraded state of our, you could say, epistemic environment, not just the epidemic environment. So we focus on the policy successes and failures, as we'll see, but also the performance of the truth-seeking departments of liberal democracy, as we think of it, science, journalism, and universities, the places we go to pursue the truth, to question public officials, to challenge public policies, and to submit important matters to public debate. And we think they have revealed themselves to be somewhat degraded, under the influence of polarization and politicization, and the premature moralization of disagreement, leading to intolerance of dissent. We have many colleagues who are focusing on the dangers of right-wing authoritarianism, and we share those concerns. But we think it's also important for educated elites, including progressive educated elites, of which we count ourselves among them, to look at our own shortcomings and think about how we may have contributed to some of these problems. So that's what the book's about. Now, thinking back, remember, of course, it was horrible. March and April 2020, the fear, the uncertainty, hospital wards being overwhelmed in Italy, in New York City, body bags and makeshift morgues. We acknowledge and by April 2020, 3.9 billion people globally living under some form of lockdown, an astonishing response to an epidemic. The worst pandemic since the Great Flu of 1918 to 1919. It was a bad pandemic. The greatest global crisis since World War II. That was partly because of the response itself. And of course, mistakes were made. And we recognize, of course, that hindsight is 20/20. But this was such an important event, and it was such an unprecedented response to a respiratory virus that we need a comprehensive political assessment. And that's what the book tries to provide. So, one thing that's very important to recognize is there were a number of pandemic planning documents that were available before the COVID pandemic. One was published just months before, weeks before really, the onset of the COVID pandemic in the fall of 2019. And these plans went through all of the various non-pharmaceutical interventions that were soon to be imposed. And they focused on the evidence to support or not support the efficacy of all of these measures. And by non-pharmaceutical interventions, I mean everything except the vaccines or drugs. So social distancing measures of all sorts, school closures, border closures, contact tracing, 6 feet, stay away 6 feet requirements, and mask requirements and so on. All of the things that we did before the availability of the vaccines and after the availability of the vaccines, of course, in many cases. And what's astonishing about all of these pre-COVID pandemic plans is that they rate the evidence in support of these measures, the efficacy, to be poor. So just a couple of quotes from these. The 2019, November it was 2019, World Health Organization plan rated all of the measures to be supported by a poor evidentiary basis. And indeed, they said that some were not recommended under any circumstances, including contact tracing, quarantine of exposed individuals, entry and exit screening, and border closures, because these would be extremely disruptive and would not, WHO felt, be productive, be efficacious. And there were other plans as well. Indeed, the World Health Organization said that workplace closure should be a last step considered only in extraordinarily severe epidemics and pandemics, and that the quality of the evidence supporting this recommendation was rated very low. School closures could have a major impact on the safety, health, and nutrition of children in lower-income families, and so potentially not cost-effective. School closures raise major ethical issues for families and communities. One of the things these pre-COVID pandemic plans were emphatic about was that these measures would be extremely costly. They would be detrimental to children, and especially detrimental to people less well off, the poor, and indeed minorities. So the pre-COVID pandemic plans were expressed great uncertainty, a lack of evidence for the efficacy of these measures, and were emphatic about the high costs of these measures, which needed to be discussed before they were being implemented. Johns Hopkins had a pre-COVID pandemic planning document in 2019 over the summer. It's important to communicate to political leaders that emphasize the absence of evidence surrounding many non-pharmaceutical interventions and the adverse consequences that may follow. The UK, 2011, had one and argued this, that it will almost certainly not be possible to contain or eradicate a new virus in its country of origin on arrival in the UK. The expectation must be that the virus will inevitably spread and that any local measures taken to disrupt or reduce the spread are likely to have very limited or partial success at a national level and cannot be relied on even as a way to buy time. Professor Robert Dingwall, who was a member of the committee for 7 years, 5 years rather, that was engaged in formulating these COVID pandemic plans, said during COVID itself, close attention was paid to whether we might shut borders, restrict internal travel, and shut schools, but we decided that these things were unworkable or at worst, counterproductive. So there were enthusiasts for non-pharmaceutical interventions, these measures to contain or suppress a respiratory virus once it appeared. Mathematical modelers who had a strong influence under George W. Bush's presidency. Bush had, yeah, are we having a sound issue? Okay. It's the hardware. Okay. No, it's better. I can get closer, sure. Yeah. No, it's okay. Is that all right? All right. It's better? Okay. So as I was saying, there were enthusiasts for these measures, mathematical modelers who projected efficacy for these measures based on estimates and predictions about how people's behavior would change and how respiratory viruses might be slowed. They did exercise quite a considerable influence under the George W. Bush administration on some initial COVID planning documents, including this one from May 2006, an implementation plan from Homeland Security Council. And they argued that modeling supports school closures as an effective means of reducing overall attack rates within communities and suggests the value of this intervention is maximized if school closure occurs early in the course of a community outbreak. Of course, just how early is early enough is not clear. They predicted that there could be a 50% reduction in peak death rates just from school closures alone. Indeed, when you look back at these documents, they saw school closures as the crucial non-pharmaceutical intervention, but one thing they don't do is model the costs of school closures for children. They treat children only as vectors of disease, and are frank about that. Now, the Institute of Medicine commissioned a group to assess these modeled recommendations of non-pharmaceutical interventions. It was led, in fact, by Dr. Adel Mahmoud, who was in the policy school, faculty member at that time, an eminent scientist. And they examined the empirical evidence around these models, and they were unconvinced that they should be recommended. Indeed, the report that they wrote in 2006, responding to the mathematical model, says this: in ideal circumstances, the goal should be to only use interventions when the demonstrated benefit outweighs the demonstrated harms. However, in conditions of severe uncertainty, this ratio will often be difficult or impossible to determine with any confidence. Furthermore, there's a real risk that in the midst of a crisis, there will be pressure for government to employ public health interventions, even in the absence of proven benefits, and without consideration of secondary effects. Therefore, it's vital that these potential secondary benefits be identified, articulated, and publicly debated. Before utilizing an unproven intervention, government officials and the communities they represent should be made aware of the intervention's potential negative effects. This was quite prescient, because one thing that happened under COVID is governors and other leaders wanted to show that they were in charge. They wanted to show that they were doing something, taking drastic actions, and indeed publics demanded such. But these reports emphasize the extreme importance of informing the public about the limited evidentiary basis and the quite certain costs of doing things like closing schools. Dr. D.A. Henderson, who led the effort to eradicate smallpox, also wrote an article with some other scientists at this time responding to the mathematical models. And they concluded communities faced with epidemics or other adverse events respond best and with least anxiety when the normal social functioning of the community is least disrupted. He was also extremely skeptical about the efficacy of these measures and warned of their extreme costs. The American Civil Liberties Union put out a report as well in 2008 in response to these recommendations. And they said American history contains vivid reminders of the danger that grafting the values of law enforcement and national security onto public health is both ineffective and dangerous. Too often, fears aroused by disease and epidemics have justified abuses of state power. Coercion and brute force are rarely necessary. In fact, they're generally counterproductive. They gratuitously breed public distrust and encourage the people who are most in need of care to evade public health authorities. Effective preventive strategies that rely on voluntary participation do work. Simply put, people do not want to contract smallpox, influenza, or other dangerous diseases. As long as public officials are working to help people rather than to punish them, people are likely to engage willingly in any and all efforts to keep their families and communities healthy. And finally, minorities and other socially disadvantaged populations tend to bear the brunt of tough public health measures. This is notable because the American Civil Liberties Union was entirely silent during the COVID epidemic, including concerning the information that came out in the case of Murthick versus Missouri, that the Biden administration secretly pressured social media companies to suppress social media postings at odds with administration policy, a matter that certainly raised First Amendment concerns, which one would have thought that the American Civil Liberties would at least comment on, but they did not. Finally, there was some initial conventional wisdom. As China closed down and countries around the world began to contemplate imposing these measures, as China did on a massive scale, various well-known scientists wrote skeptically in the Washington Post, the New York Times, and elsewhere. Here's a public health open letter that was published, led by Greg Gonsalves and signed by 800 other public health scholars, expressing skepticism about these lockdown measures. Mandatory quarantines, lockdowns, travel bans have large social costs and disproportionately affect the most vulnerable segments of our communities. Voluntary self-isolation measures are more likely to induce cooperation and protect public trust. Coercive measures are more likely to spur evasion. And there was other initial conventional wisdom expressing skepticism about these measures. March 16th, former CDC Director Tom Frieden: "We must consider the huge societal costs of closing schools against what may be little or no health benefit." Dr. David Katz of Yale: "Is our fight against coronavirus worse than the disease? Clamping down the whole population means as soon as the clamp is released, the whole population is in danger. The result could be severe restrictions on the whole society with no end in sight." Michael Osterholm, University of Minnesota: if governors close schools with few cases, how will they reopen with more cases? We've got people literally just falling each other off the edge of a cliff because they're not thinking. And he went on with Michael Olshaker in the Washington Post: "Hong Kong closed schools. Singapore did not. Hardly any difference in the rate of transmission. School closures harm the least able to afford to miss work and care for homebound children, healthcare professionals, firefighters, police officers, utility workers, delivery drivers. The best alternative will probably entail letting those at low risk for serious disease continue to work, while advising higher risk individuals to protect themselves through physical distancing and ramping up our healthcare capacity. Then build up herd immunity via natural infection and recovery, without harming millions of school children and others." And with a frankness that soon became rare, he said, March 21, 2020, "People will get sick, some will die, and our healthcare system is going to be overrun to a great extent, no matter what we do." All right, I'm going to turn it over to Francis now to talk about pandemic policymaking.
As we look back to the policy response to the pandemic in the U.S., the key decision makers were the governors. Federal officials played a key advisory role, but the governors possessed the quarantine power and other legal authorities to respond to the crisis. But as Steve discussed, the guidance they had access to in the pre-pandemic plans was not clear. Expert opinion in the U.S. and around the world had begun to shift, however, towards the use of non-pharmaceutical interventions in February 2020. China imposed a lockdown of Wuhan on January 22nd, which was the largest quarantine in human history to that point. With COVID cases falling steadily in Wuhan after January 23rd, the World Health Organization's Director General said that China had set a new standard for a pandemic response. Governments around the world began to move towards lockdown after March the 16th, when a team at Imperial College in London issued a bombshell report projecting that the uncontrolled spread of COVID-19 would cause death on a massive scale. Without social distancing, the report projected that there would be 2.2 million deaths in the United States by August of 2020. For governors, the most important clearinghouse for information was the White House Coronavirus Task Force. But no clear direction emerged from that center until March the 16th. That's the same day as the publication of that Imperial College report. On that day, at a presidential press conference, the administration issued recommendations that in states where there's evidence of community transmission, governors should close non-essential businesses and all places, indoor and outdoor, where people congregate, including schools. Now, the first thing to know about pandemic policy in the US is that it was not initially party polarized. There were only slight partisan differences in how governors approached the pandemic at the start, but then those differences expanded over time. At the start, 43 governors issued stay-at-home orders, and even those governors that declined to explicitly issue a stay-at-home order, all but one nevertheless closed businesses, closed non-essential businesses. Governors then varied significantly in how long they kept those restrictions in place. And as some states reopened while others stayed closed, you had a crazy patchwork of different policies around the US. And as we look at that emerging variation, you see that the Republican and Democratic states go different ways. States with Republican governors maintained the closures for much longer than, states with Democratic governors maintained those closures for much longer than states with Republican governors. You can also see there's a little bit more hesitation. Republican governors were a little bit slower, but just a matter of a few days in issuing those stay-at-home orders. The big difference is in the length of them. Democratic states maintained them for about 2.5 times as long as Republican states. By March the 25th, all public schools in the United States, serving more than 50 million students, were closed, and nearly all would stay closed for the balance of the 2019-2020 school year. State-by-state variation in reopening schools would then be very wide. Across the South and the Mountain West, public schools reopened in August of 2020, but nearly half of public schools were still closed in March of 2021. The length of school closures correlates strongly with states' partisan lean as gauged by the 2020 presidential vote. The more Democratic the state, the longer the school closures. Note that the y-axis in this graph covers the whole range from almost fully open to almost fully closed. At the same time as governors implemented stay-at-home orders in March of 2020, they also imposed other orders to enforce social distancing. Such orders took many different forms: travel restrictions and quarantine requirements, mandated telework, restrictions on gatherings, closures of non-essential businesses. States then removed these restrictions piecemeal at varying rates around the country over the next year to 14 months. To track these patterns, researchers at Oxford University compile a stringency index to measure the restrictiveness of the pandemic response based on 9 indicators, which are listed here. They collected these data for all of the US states over time through the pandemic, as well as for countries around the world. The index is scaled from 0 to 100, with 100 being the strictest. This graph displays the average stringency index for each month of the pandemic for states grouped by partisan lean, from strongly Republican states, shown in dark red, to strongly Democratic states, shown in dark blue. Key thing to take away from this graph is that the states stay well sorted in the stringency of their response all through the pandemic. So Democratic states are always more restrictive than Republican states, with the competitive states generally kind of in the middle. A second thing to know is that the stringency of the response is not very responsive to conditions in the pandemic. The worst wave of the pandemic was the winter 2020 wave. But all across the US, in red states and blue states alike, the restrictions were less in that most intense wave than they had been in the spring of 2020. Every state carried out a mass vaccination campaign paid for by federal dollars, but there was remarkably higher acceptance of vaccines in Democratic-leaning states than in Republican-leaning states. The bivariate relationship between state partisanship and vaccine uptake is remarkably robust by social science standards. So this is how states differed in their pandemic response, both in terms of the non-pharmaceutical interventions and the pharmaceutical interventions. So you can see there was wide variation, and that variation to a considerable degree tracks political party. So then what are the outcomes? Well, how did states fare? This figure displays cumulative COVID mortality per capita for each month of the pandemic in states grouped by their partisan lean. And as you can see, looking at the end of the graph on the far right, Republican-leaning states had suffered considerably higher mortality, about roughly 30% higher than Democratic states by January 2023. However, if you examine COVID mortality across the period before vaccines became available, there's no statistically significant difference between Republican and Democratic states. The differences in COVID outcomes between Republican and Democratic-leaning states emerge and grow progressively wider in the post-vaccine period. But there were no differences between those states at the time the vaccines were rolled out. Not surprisingly, the analysis points to a strong relationship between states' level of vaccine uptake and COVID mortality rates. The least vaccinated state experienced fully 1.6 times as much COVID mortality as the most vaccinated states. However, the different policy states pursued before vaccines became available don't bear a close relationship to COVID mortality. Imposing stay-at-home orders more quickly did not make a difference in pandemic outcomes. This is true even if you take out the states that were hit hardest in that first wave before any action had been taken. Keeping stay-at-home orders in place longer also did not make a measurable difference in COVID mortality. States that kept schools closed longer did not fare better in COVID outcomes than states that reopened them more quickly. Finally, drawing on the Oxford Stringency Index, states imposing more stringent COVID restrictions did not fare better than states with less stringent restrictions. Just as we finished collecting our data and conducting our analyses in spring 2023, a similar paper analyzing the effects of cross-state variation in pandemic policy came out in The Lancet. The lead author is Thomas Bollocky, and his research team and co-authors are largely drawn from the University of Washington's Institute for Health Metrics and Evaluation. They're using different data sets on pandemic policy than the ones that we collected, and their dependent variable is age-standardized COVID death rates. But as you can see here, only the vaccine mandates had or were associated with lower COVID mortality. The non-pharmaceutical interventions, the stay-at-home orders, the mask mandates, the closures, they did not find them to have a statistically significant effect on COVID outcomes. Another cross-validating study, this one it was a study by Italian health scholars at the University of Milan. This was published in the summer of 2024 in the Lancet Regional Health Europe. They're examining the effect of policy variation on excess mortality in Europe across the 29 countries of Europe. The dependent variable is the variation in each country's 10-year prior mortality baseline. So it looks at variation over the annual mortality rate for each country for each year of the pandemic. So 2020, 2021, and 2022. You can see in the top left corner, that looks at the relationship between vaccine uptake and COVID mortality. And just like we find across the states, there's a clear relationship between countries, jurisdictions with higher vaccine uptake and lower COVID mortality. But they don't find a relationship with the stringency of COVID restrictions in any of the 3 years of the pandemic. And the variation in the COVID response across Europe was even wider than in the US. You had countries with no lockdowns, like Sweden, and you had countries with only one lockdown, like Switzerland, and other countries that had 3 or more lockdowns. So wide variation, but not a statistically significant effect. So what have we learned? Have we learned anything in policy terms? The report for the Scottish COVID-19 inquiry, which came out in July 2023, more or less says no. These are the key passages. In 2020, there was scientific evidence to support the use of some of the physical measures adopted against COVID-19. such as frequent hand washing and the use of PPE in hospital settings. But for other measures, as in face mask mandates outside of hospital settings, lockdowns, social distancing, test, trace, and isolate measures, there was either insufficient evidence or alternatively no evidence, and the evidence base has not changed materially in the intervening 3 years. So if there haven't been policy lessons learned, have there been political lessons learned? And here too, the evidence suggests no, that instead of the public coalescing on a common understanding of how to interpret what happened and what was done during the pandemic, instead, public opinion has increasingly polarized, so that you see a widening divergence in the attitudes towards public health officials between Republicans and Democrats over the course of the pandemic. You also see governors taking every possible position on the pandemic, winning re-election resoundingly. In fact, governors maintained high approval ratings in the aftermath of the pandemic, regardless of party. So you might say in that sense that no matter what approach policymakers took, they saw themselves, or they experienced a kind of vindication. You might say that democracy worked in that sense in the U.S., that people were happy with the government that they got, even as it varied considerably around the country. Now, we also devote time in the book to considering the costs of the pandemic response. This was something that, as Steve discussed at the outset, the pre-pandemic plans warned that attention would need to be paid to the cost side of the ledger. We look at the costs as we are able to ascertain them from studies that have been done, secondary literature on physical and mental health, on public debt, on unemployment, on the cost of living, on education, crime, and social dislocation. I can't go through all of those in the time we have today. I'll hit just a few of the key points here. First, in terms of the effects on physical and mental health, there were health costs associated with pandemic policy, in addition to the health effects of the pandemic itself. There were lengthy delays imposed on non-essential and elective care, followed by significant backlogs once that care resumed. Cancer screening declined drastically. Excess deaths during the pandemic were surprisingly high, even in demographics that were little affected by COVID. There were surges in deaths associated with heart disease and diabetes, possibly due to interruptions in routine care for chronic conditions. Minority populations were especially adversely affected. More than a third of excess deaths among Black Americans during the pandemic are not explained by COVID. There were effects on mental health as well. Studies repeatedly documented increases in anxiety, depression, and in eating disorders, particularly among children and adolescents. There was a sharp increase in deaths due to substance abuse and overdose during the pandemic. The response to the COVID pandemic entailed the most extensive and lengthy disruptions to education in history. The National Assessment of Educational Progress, often referred to as the nation's report card, showed unprecedented drops in student learning in both reading and math. And there's not been any large-scale recovery since. In fact, reports here in 2025 show that students have still not gotten back to 2019 levels. That continued deterioration in some areas likely results from chronic absenteeism, which roughly doubled around the country from prior to the pandemic. Learning losses were greater in high poverty districts for Black and Hispanic students and for students who were struggling before the pandemic. The COVID pandemic triggered the largest ever crisis response in United States history. Congress allocated more than $5 trillion in new spending, most of which was allocated to keeping businesses and individuals afloat through the closures. Only about 10% of all pandemic spending was directed to the costs of hospitals, health care, or vaccine development. Gauged by expenditures relative to gross domestic product, 2020 pandemic aid was bigger than the 2009 stimulus package and the whole New Deal combined. 2021 pandemic aid was roughly the same size as the New Deal, as gauged by a share of GDP. All of these expenditures were added to the national debt. In the first quarter of 2020, total debt held by the public leapt from 80% of GDP to more than 100%. And that persists in that higher plateau. And of course, there's a high ongoing burden of debt service associated with that constrains our ability to respond to the next crisis or to address other priorities. So I'm only scratching the surface here in terms of the range of societal effects from the pandemic response, and there's room for a lot more research in this area. And I'll turn back to Steve now, who will offer some additional reflections on how our democracy responded to the pandemic.
Thank you, Francis. So as I said at the beginning, the book is a window onto the policy choices that were made, and their outcomes, or lack of outcomes in some cases, but it's also a window onto the performance of, as I said before, the truth-seeking departments of liberal democracy. So it was just a quick way onto some of that. We have a whole chapter on the mask controversy, a whole chapter on the origins of the virus, and a chapter on noble lies, but I'll just skirt over them. There's an article in the Journal of the American Medical Association's Network Open 2023, which makes some points that have been repeated many places, but it describes COVID misinformation by doctors on their social media platforms. And the aim of the article is to help governments and professional bodies take actions to regulate or discipline physicians posting these messages. It laments that few physicians appear to have faced disciplinary action. And it defines misinformation as false, inaccurate, or misleading information according to the best evidence available at the time. That itself is an interesting phrase, since we normally think those who dissent from a current consensus maybe may not be charged with misinformation, but rather just being dissenters. In any case, some of what the article describes, of course, is real misinformation about vaccine ineffectiveness and risks, but it includes these 5 categories of claims that it calls misinformation that should be punished by the government or by professional associations. Suggestions that natural infection and recovery contribute effectively to population level or herd immunity as well or better than vaccines. That government and public health officials withheld key information regarding COVID-19, and that the virus originated in a laboratory in China, was part of a National Institutes of Health funded study, was leaked, and the leak was covered up by government and other public health officials. These are called conspiracy theories by the article. That government actors were in contact with Twitter and other social media companies telling them what to censor and who to censor, in many cases, regarding COVID-19 information. And doubts about the effectiveness of masks and suggestions that masking imposed special costs on children. These matters are all either true or arguably true, and were matters certainly of reasonable public debate. So just a couple of quick words about all of them. On natural versus vaccine-induced immunity, there really was never any reason to doubt that getting the virus and recovering from it would contribute to immunity. Vaccines only mimic the effect of getting a virus and recovering. But yet, the World Health Organization changed the definition of herd immunity on its website over the summer of 2020. Defining herd immunity, this was in the spring, indirect protection from an infectious disease that happens. This is correct definition, when a population is immune either through vaccination or immunity developed through previous infection. But over the summer, it changed that definition to say that it's a concept used for vaccination only. What was going on here was that the World Health Organization and others were, we're trying to encourage people to wait for the vaccine rather than get the virus. But they were misleading. So the misinformation was coming not from what the Journal of the American Medical Association said, but from those who were denying the existence of natural immunity. It wasn't proper to mislead people in this way in order to encourage them. And it's the sort of thing that has encouraged distrust, to deny that people who got the virus and recovered had some immunity. That was also damaging to people because they could have aided in hospitals those who were sick. They could have aided their elderly relatives because they had some immunity. And they were denied that knowledge by this misleading information from the WHO. And there's plenty of studies that indicate that natural immunity and vaccines have equal, or that natural infection and recovery provides greater immunity, just as one would have thought. And these meta-studies were all available at the time of the JAMA article. Did public health officials withhold important information? Well, here's a quote from Francis Collins, director of the National Institutes of Health. "What I did was wrong because I had plenty of these moments in television interviews where we failed to say every time there was a recommendation, guys, this is the best we can do right now. It's a good chance this is wrong. We didn't say that. We wanted to be sure people actually motivated themselves by what we said, because we wanted change to happen in case it was right. But we did not admit our ignorance, and that was a profound mistake, and we lost a lot of credibility along the way. So it's clear that there were public health officials withholding information. We could also look at the origins of the lab in this guise as well, in respect to this category. Dr. Collins said in May 2020, neither the National Institutes of Health nor National Institutes of Allergic and Infectious Diseases, a sub-unit of the National Institutes of Health, have ever approved any grant that would have supported gain-of-function research on coronaviruses, increasing their transmissibility or lethality. And yet we know from Freedom of Information requests and documents that have become available that the National Institutes of Health gave millions of dollars to a nonprofit called EcoHealth Alliance, Peter Daszak president, and the EcoHealth Alliance funneled hundreds of thousands of dollars in subawards to the Wuhan Institute of Virology, and grant applications to NIH from EcoHealth explicitly spell out work involving the creation of deadlier or more transmissible pathogens, coronaviruses in particular. It said the researchers would use infectious clone technology and humanized mice to test availability of newly created coronaviruses to infect humans. The scientists who suspected lab leaks, so this is kind of the last point I'll make, is that we now know that in February 2020, there were scientists who read an article, actually co-authored by scientists at the Wuhan Institute, and suspected, because they knew the genetic sequence of the novel coronavirus by then, and they suspected that this article made them suspect that it was that the virus that we had was the result of the sort of manipulation that was described in the article. So Dr. Christian Anderson was the scientist who discovered this, Scripps Institute. He found an academic paper, and we have Freedom of Information request emails and Slack messages from all these scientists, their private communications while they were mulling this over and discussing it. So he says to a colleague of his, it looks like a how-to manual for building the coronavirus in a laboratory, the one that caused the pandemic. So on January 30th, he emailed a colleague, Edward Holmes, another virus expert, Eddie, can we talk? I need to be pulled off off a ledge here. The pair knew of a laboratory where researchers had been experimenting on coronaviruses for years, namely the Wuhan Institute. Fuck, this is bad, was Holmes' response. And as I said, we have these emails, and Jamie Farrer writes about them in his book, Spike. So they communicated their belief in lab origin to doctors Anthony Fauci, Francis Collins, Jamie Farrer, Wellcome Trust, and others, and they arranged very quickly, the next day, I think, basically, a long phone call to discuss these matters and what should be said. This is around February 1st, 2020. So after these hardly arranged phone calls, Anderson and his co-authors, Holmes, Dr. Amber Rambo, and others, set out to write a paper called Proximal Origins of the Virus that aimed not to air the evidence that formed the basis for their suspicions about a lab leak, but to debunk that theory, as they said. And we have their Slack messages that they were sending to each other, the authors of the article, while they were composing this article after having had the phone call with Drs. Fauci, Collins, and others. And they say things like this. Rambo, the main issue is that accidental escape is in fact highly likely. It's not some fringe theory. I absolutely agree that we can't prove one way or the other. Maybe we never will be able to. Anderson, although I hate it when politics is injected into science, it's impossible not to given the circumstances. Rambo, it would be a shit show if anyone seriously accused the Chinese of even accidental release. And Anderson to a German scientist a few weeks later, our main work over the last couple of weeks has been focusing on trying to disprove any type of lab theory. So this was science motivated by politics in order to discourage discussion of the possibility of a lab leak that was the result of research, not necessarily on the specific virus, but research that was being funded actually by the US government in part on similar coronaviruses. So Anderson's lab got a $1.9 million grant a few weeks later from the National Institutes of Health, and in fact, the grant was sitting on his desk. I'm not saying that that's the only reason why he did this, but we figured out in talking to people about this that public health is a uniquely hierarchical field in which government funding just dominates the field. The National Institutes are by far the largest funding agency in the world. And so that really seems to have led to some of this discipline when it comes to what we're going to talk about. And it still affects, I think, scientists' willingness to acknowledge what many think, which is that these guys have not been telling the truth. We've heard from many scientists who say, yeah, I don't think they're telling the truth. Would you say it in public? No, I wouldn't. Well, why not? We're talking about the leak of the worst pandemic in a century. Gain-of-function research is going on, and scientists whose field it is, to study and to review people's work in this area are not willing to tell the truth. I don't think that would happen in political science. We've had research misconduct that has been called out, and there's been accountability. I think it's scandalous that this is not, that there's no public accountability as of yet. In any case, there was also, I'm going to conclude, but there was also, I mentioned the case of Merthick versus Missouri. There's plenty of evidence there that the Biden administration was in touch with social media companies, telling them to censor accounts at scale that challenged official messaging, including on things like the efficacy of masks and so on. Jay Bhattacharya's account was suppressed and so on. And at least we should, be thinking about the First Amendment implications of this happening. I mean, the Biden administration said we won't do it anymore, and the case was dismissed by the Supreme Court on jurisdictional grounds because the policy had ended. Again, surprising that the ACLU never filed a brief in this case, which involved government censorship of dissenting messages related to the most important public policies in the country. We have a chapter on masks. I won't say that, but the evidence has always been weak for community masking to prevent respiratory viruses. So just why did we do it? What should we learn? Well, faulty leadership. Francis indicated some of this. Andrew Cuomo focused only on preventing viruses regardless of cost. People loved him because he wasn't Trump, and he got an Emmy for his news conferences and so on. But he never really considered the costs, as he was warned to do so by those pre-COVID plans. Journalism constantly asked why we weren't doing more, really one-sided. They ignored, evidence. Schools opened in Europe in April 2020 without incident, but nobody reported that. We had plenty of information about schools being reopened. They never closed in some places. In Sweden, they were open in Iceland quite early. There were studies coming out from these places, and they were just ignored by the press. Elite failures, too much power to narrow experts. I talked about this quote from Francis Collins. If you're a public health person, you have this very narrow view of what the right decision is, and that's something that will save a life. It doesn't matter what else happens, so you attach infinite value to stopping disease to save a life. You attach zero value to whether this totally disrupts many people's lives, ruins the economy, has many kids kept out of school in a way that they never recover from. This is a public health mindset. And I think a lot of us involved in trying to make those recommendations had that mindset. Quite remarkable. Premature closure of debate was an important factor here. We talked about the March dissenters before, very prominent people like Tom Fried and Michael Osterholm. But in April, partly in response to a national document, recommendations that were put out by the Safra Center at Harvard in conjunction with the Rockefeller Foundation and so on, that document called for wartime unity on the chosen strategy, which was stringent lockdowns following China to suppress the virus, and to test, trace, and supportively isolate to suppress the virus. And subsequent to that, we think it became the case that dissent was not welcomed. This document, and many others at that time, called for wartime unity. And dissent was as unwelcome during the war on COVID as it was during World War I and World War II. And in the Cold War. So we repeated the mistakes, frankly, of not respecting free speech and freedom of dissent as we have in the past. And the wartime framing was all over the place, from Sanjay Gupta and otherwise. Significant class bias, I'll just skip that. Many of us were able to stay at home, work from home on our computers, but a third of workers in the country kept going to work in order to continue, keep our electricity on, food delivered, food processed, and so on. And their kids, had a harder time staying home from school, when the parents had to work. Polarized and moralized political identities, as I said, I think that's played a big role here, and it affects the academy, it affects scholarship, it affects, right now, even scientists willing to tell the truth about the origins of the virus. And I think more general issues of bias in science in the academy, I strongly recommend an article by Corey Clark et al. From fall of 2023, talking about pro-social motives that underlie much scientific censorship by scientists, a terrific piece from the Proceedings of the National Academy that's worth having a look at. Just an editorial in Nature, the fourth one down there, authors, reviewers, and editors must consider potentially harmful implications of their research. Well, I mean, isn't that sort of begging the question if you're doing empirical research? Now, as I mentioned before, and this will be the final point, the things I've been talking about here about misinformation are not in the past. So just in February 21st, 2025, Nature, the public-facing magazine associated with the scientific journal, published an article called "What Sparked the COVID Pandemic? Mounting Evidence Points to Raccoon Dogs." Well, it's simply not true. Mounting evidence does not point to raccoon dogs. The article quotes 6 scientists and 6 scientists only, including Christian Anderson and Edward Holmes, whose names you'll remember from February and January 2020, and their co-authors. Marion Koopmans, I think, was involved in that phone call on February 1st. Angela Rasmussen, Jonathan, Michael Warraby, they've all co-authored together, and Warraby's article has been refuted, and he's never responded to the critics. They don't quote anyone on the other side, as if as if the debate is not worth having. So it doesn't even, I think there's no pretense here of offering a balanced view of the issue. And that's appalling. We're talking about a public-facing, highly regarded magazine of a very important scientific journal. So what did Richard Ebright is a bit of a hothead from New Brunswick, Rutgers, but he's not wrong about lots of things. So he says this. He put this out on February 21st. The writer, referring to that article, the writer, the editor, and each and every person quoted in this article knows SARS-CoV-2 entered humans through a research incident. They are lying. They know they're lying. We know they're lying, and they know we know they're lying. I think that's probably more or less true. Gain-of-function research continues to go on. It remains extremely dangerous, that this story is not being more talked about, that there aren't episodes on 60 Minutes and so on, that's not being covered more by the New York Times. Matt Ridley just had a piece come out today surveying the evidence. He was commissioned to write it. He can't get it published in a scientific journal, so he published it on a Substack. Much of what the research for this book is drawn from Substacks because things are not available in a lot of the mainstream venues. So just ending on what do we need? The need for greater toleration of disagreement, greater respect for dissent, even in the face of our partisan diversity, recognizing that those on the other side of the political spectrum are not always wrong. Greater humility on the part of experts and elites, greater honesty, acknowledging uncertainty, especially in public health, which seems to be very hierarchical and to want to present a united front. Greater openness and transparency in science and scientific journals. Some of these are not rewarded in the communications ecosystem and in politics, but they're the core virtues on which science, journalism, and the academy depend, and we need to be more alert to them. So anyway, thank you very much, and thank you again for publishing the book, and we're happy to respond to questions insofar as there's time. Thank you.
Or YouTube, anything coming through our chats? Good news that the mics did readjust and people could hear. Thank you.
So I have a couple questions. Did you do an international comparison of the costs of the non-pharmaceutical interventions? And then secondly, I'm wondering, so when the Wuhan lab leak theory came out, everybody said, oh, that's, conspiracy theories, we need to shut that down. Have you looked at other conspiracy theories, things people are calling conspiracy theories, and kind of reevaluated those? I don't know, currently the issue of genocide in South Africa,
We haven't had a lot of time to look at that one yet, if you're talking.
But I mean, and so how do we critically look at, things we're just shutting down immediately because, we consider them just conspiracy theories?
Yeah, how do I press the button just as though this is working? Yeah, I mean, I think the short answer to that last one is basically no. We started the research on this book in really 2022. So, we've been, and it took some digging to find, these things. They're now coming out in places, but, some of this was discovered, again, Substacks. Paul D. Thacker, who used to work for the Washington Post but has a Substack, had a lot of good stuff. U.S. Right to Know is an institution that does a lot of FOIA requests, Freedom of Information Act requests, and so on. So a lot of these documents had to be uncovered, and they haven't been reported in mainstream places. So no, we haven't. Daniel Immerwahr has a piece in the current New Yorker that touches on some of these issues. Now, a conspiracy theory past scandal that he mentions as a possible, having some possible parallels is the Kennedy assassination. He does that partly because Robert F. Kennedy Jr. is back in the news and so on, and that's been one of the things that he's been skeptical about. There have been hearings on that more recently. I'm not going to go there, but there certainly has been reasons to think that the Warren Commission, was partly about putting things to rest. There's more information coming on CIA connections, not necessarily involvement. But anyway, so we haven't researched the general topic. It's something we're quite interested in. And there are books that have come out that are on adjacent topics. Hale and Patterson have a book out from MIT on expertise and the tendency of experts. I think we'll say that one book that we found very helpful to go back to is Cicely Bach's book on lying that was published in the 80s and 90s. And that really focuses on the tendency of educated elites to not trust the masses, to believe they need to be told noble lies. It's really an institutionally focused book about the tendency of elites to not trust the masses and to tell the public what they think they need to hear for the sake of doing the right thing and so on. So, but we have not researched this as a general matter. On the costs in other countries, Francis may have sort of some information on that.
I mean, it's a lot of work just to survey the literature on the costs here in the U.S. I have been attending to, and of course in the course of doing the research, you come across other work on other countries. I can say that the parallels are quite interesting. U.S. had unusually long school closures. We're really more comparable to the developing world in terms of how long our school closures were than to other advanced democracies. But even in the advanced democracies, you see lasting effects of even the shorter school closures that they had. And the big rise in absenteeism is not confined to the U.S. It happened everywhere. I think that what young people learned during the pandemic was that school was less important than other things. And so it's been hard to get those habits of school attendance back. The rise in public debt, that's a transnational phenomenon. Inflation was a worldwide post-pandemic phenomenon. Rise in housing costs was worldwide. So a lot of parallels from what happened here in the U.S. and other countries. We did spend more. We provided more relief than many countries. China did almost nothing to support the people through their closures. Like it was very, very brutal in some places. Same in Latin America, that these closures would be imposed, and then people would get maybe one check from the government, kind of like our checks, but no unemployment benefits. It's very, very difficult. So I think that's why I think that this is an area that just needs a whole lot more research to understand, what the policy effects have been around the world.
Thank you. This is absolutely fascinating and also shocking, of course, thinking back on what we all went through. I take it you would say that we haven't learned anything, and that if this happened again, where are we exactly? And then, as a follow-up question, what do you recommend to anybody, to us, for example? How should one distill the truth if, not listening to some of these government agencies? Like, where should we get the information from?
Yeah, I'm not going to say about, what should we do. I do think we need to be much more open to dissent and to a variety of viewpoints. Apparently Robert Redfield, who was head of the CDC during, this era, he was the guy with a little beard and so on. Deborah Birx, of course, wore the scarves, and, we all know Anthony Fauci, but he had the little beard. He wrote a memoir and he couldn't get it published, because he thought right from the start that the virus had leaked from a lab. He told his colleagues that, and then they kept him out of the meetings. And he's been quite frank. And he had talked to the head of the Chinese CDC, and so had lots of inside information and so on, and was telling the truth, and also was very concerned about gain-of-function research, which Anthony Fauci and Francis Collins both have strongly supported. So we need to be open to dissent, even if it's associated with the partisan other, as it were. There's a very good book on schools, specifically by David Zweig, and they published at MIT Press. Just came out, called An Abundance of Caution. It's a really superb book. Francis and I think very highly of it. But I think, as academics, as publishers, the main thing is to not impose premature closure on debates because of the partisan inflection. And I think that's just something we need to be very, very concerned about, because I think that happened here to a great degree.
I think we need a learning process. I mean, Steve and I are not public health scholars. We're scholars of politics, and Steve, normative theory, democratic theory. So we look back at the pandemic through those lenses, and we see a deficiency of critical thinking and discussion and assessment. And so this can happen through government agencies, and should happen in government agencies, can happen through political accountability, like hearings or commissions, but it can also just happen in society through the kinds of discussions that we're having here and publication of works and studies. I think that we can reach a better common understanding and learn what we can learn. I mean, the pandemic did not involve randomized controlled trials of these measures. So that limits what kind of inference we can draw. But we can look at the variation around the world and see what the outcomes were, just like we do in our book, looking at the variation across the US. And the results are very ambiguous. I mean, we don't make claims that, we've definitively shown that non-pharmaceutical interventions don't work. That's not what we are claiming based on the study. What we would say in a social science sense is that there's not clear evidence that they do work. Just like there wasn't clear evidence before the pandemic that they would work. Here we are in 2025, we've been through all of this, and there's not clear evidence that they did. So I think that's where we should begin the discussion. We should look around the world and see what we can agree to as we take a close look at the evidence.
I mean, we could have learned more. We could have done randomized controlled trials, during the pandemic. We could have studied greater. What happened when schools opened? What happens when schools stayed closed? It happened quite a lot. Zweig, again, talks about this in his book. And there were lots of studies that came out in April, May 2020, based on other countries' experience. And they were not reported here. They weren't followed up. We didn't do controlled trials. There were some in Massachusetts involving YMCAs, because some of them did distance and some of them were in person. And, there was some people, it was all cobbled together. The government didn't do any of this. The CDC didn't do it. It was people, taking the initiative, decentralized in various places, just deciding this is something we need to know. So it's astonishing that public health officials and public health agencies didn't take the opportunity to study better what the effects of these measures were. So we're doing the best we can with the evidence that's available. We got some skepticism from people saying, hold on, we must have reduced the transmission rates and so on. Well, maybe we reduce transmission a bit, but we can't show outcomes for mortality and morbidity. And there aren't studies out there that show the impact on mortality and morbidity. Some of them argue that there were reductions in transmission of the virus. Okay, but where is the outcome? Vaccines definitely had an impact on mortality, morbidity. That's not hard to find, but it's very hard to find good evidence that these other interventions that were costly had an impact on mortality and morbidity.
And when you're asking a question, if you could introduce yourself, because our viewers on YouTube don't recognize us all by voice. This is Christy Henry speaking. Sorry.
Thank you. This is Connor Johnston speaking. During your presentation, I was reminded how when the initial vaccine rollout came out, Trump was still in office. So he had to deal with the balancing act of telling people that he created the vaccine and you should take it, but also that it doesn't work, and if you take it, you're going to die. Do you think that reaction rolled into the Biden administration's decision to have like a hard stamp on any COVID disinformation, or do you think that was something that was always going to happen regardless of the administration?
Yeah, I don't know. I mean, the Democrats took up the vaccine much more quickly. Republicans, in spite of Trump's having, as you said, had Operation Warp Speed and got the virus done quite quickly. There was more reluctance on the part of Republicans. It's a good, we're doing a lot of reporting in this book. It's important to understand what happened around government censorship. We don't do a lot of analysis of motives because we're not sure. So exactly why the Biden administration, decided to do this. Andy Slavitt has a memoir that I've read. He was just very confident that these measures were working, including mask wearing. I mean, actually, he says at one point in his book that he talked to Michael Osterholm, and Osterholm was very clear with him that masks are not going to work to stop this respiratory virus, that it's aerosolized. But Slavitt himself seems to forget that 70 pages later and is condemning people who don't wear masks. So it's weird. I think there was a lot of conviction there that these NPI measures must have been working. They were committed to them. And so they really thought, I think, that some of this contrary claims, including by people like Jay Bhattacharya and others that are now in the government, were poorly motivated misinformation. And people are still saying that about the lab leak possibility, rather surprisingly. But I'm not sure about motives. I'm not sure I can tell you what the motives were.
There is this interesting feature of the vaccine rollout, which is that there was a delay in the announcement of the success of the vaccine trials until immediately after the election. It was about a month before that, they said that the trials had been successful, but then there was a campaign basically to say we need more testing. I mean, Democrats were very worried about the vaccine rolling out before the election and that Trump would claim credit. And of course, he did try to claim credit for it. It was something he discovered later on when he would try to claim credit for it. His supporters at the rallies would boo. So I think this was very bottom up. You could see it from early on in the vaccine rollout that Democrats were just much more eager to get vaccinated than Republicans. I don't think it's a clear consequence of anything Trump did. He got vaccinated quite quickly himself. And tried to take some credit for it, but just couldn't really get any traction with that. Meanwhile, if you look back in October of 2020, you can find like Kamala Harris saying, "I'm not going to take a Trump vaccine." There were others expressing skepticism about any vaccine that would be rushed out before the election. So I think, politics is intervening in complex ways on the vaccine rollout, but that in the end, it was just Democrats who were more primed to sort of trust the science and accepted vaccination at a higher rate and more quickly. And it's consistent. I mean, all of the data that we have suggests that helped. And that populations that had the higher vaccine uptake did better.
Other questions? I'm curious about this whole ecosystem of Substack and other references, speaking from a place that's steeped in peer review and expertise and what it means about the sort of foundation of research and how you're guiding your students now. I mean, a lot of what you've shared with us was purposefully absent of peer-reviewed literature. In fact, some of the peer-reviewed literature was pointed to have great fallacies. So how does it get you to rethink what you rely on as scholars and what you advise your students on as you're teaching these abilities to sort of research critically?
I'll say I thought a lot about that when we were working on the 50-state comparisons. It's not very difficult research to do, and there are many similar studies like this of policy diffusion across the states and variation in policy outcomes across states. There's a lot of, it's not a super creative research design to look at how states varied in their response and what the outcomes were. We're not the only ones who have this data. I think other people looked at it, but saw the null results and decided there wasn't a story, that there's a file drawer problem here. So that there should be more published on this. I think there probably would have been a great deal more published on it if the results had been more to expectations. So I think that's that kind of bias that we see, at least in that area. On the lab leak, well, Steve can speak more to that. That's where we rely more on the FOIA requests and on the investigative reporting that's been done and published in Substack. For the 50-state study, that's just data, the CDC data on outcomes. On the stay-at-home orders, well, those are legal documents, so we can find the dates on those. That research was not terribly difficult to do, and then of course it's been cross-validated by some other work with different data. Like I said, I know of a number of scholars who were collecting data on variation in when mask mandates were imposed and when they were lifted, and all these features of the response that people invested a great deal of faith in at the time, and yet there's just not much in the literature.
Yeah, I'll just say that it's made me obviously more skeptical in some cases where there are establishment narratives that reflect, in many cases it'll be a progressive, political disposition, and that we should be looking more and entertaining more criticism. I'll say that it's made me much more alert to the possible value of viewpoint diversity in academia and publishing and universities, and I hope. It's not like we haven't dismissed the importance of expertise in democracy. We think expertise is hugely important. But we did come across many instances, including some we didn't include in the book, where somehow we have the emails, from journal authors to editors, in some cases saying if it was evidence that supported, the favored theory, possible lab origin, we're going to put this on a fast track, this is great, and so on. Don't you worry about it, the editor's saying, I'm going to, make sure that this goes through quickly. And in other cases, it's clear that the things have been held up, for a long time. And also that, people aren't responding to critics, earnest critics of the geospatial analysis that sees cases around the wet market in Wuhan. That article that's regarded as the most plausible evidence in support of a natural origin from the market has been subject to withering criticism by people that are just data people. They're saying this data is not credible, it's flawed, and rather than responding in an academic setting, the authors of that article responded to the German press saying these people are missing the big picture. These kind of vague, condemnatory, dismissive remarks. So it's just, and I don't know where the outrage is from, aside from there are people like Richard Ebright, who unfortunately goes too far rhetorically in some settings. I don't know why there isn't more insistence on truth-telling in some of these venues.
Hi, it was a great talk. As I think back to the reaction to the lab leak, it's sort of, the idea of the lab leak, if I recall correctly, is kind of a perfect storm, right? In the United States economy and the Chinese economies are so interlocked. We relied on them for a lot of the stuff we needed for medical supplies and what have you, kind of basic stuff. We were worried, I think, if I recall correctly, that if we went against the WHO's determination and it wasn't a lab leak, that would, at least among progressives, because I don't think the right cared, but at least among progressives, that would weaken our position with the WHO, make us more of a pariah. But I think very importantly, it's kind of this post-George Floyd moment where there is this alleged, upswing in anti-Asian hate crime in the United States, which turned out to be, if I recall correctly, a lot of it just was mixed up in a general increase in violent crime in cities. And that kind of overdetermined the response. But I guess my question is that do those sorts of things, as a kind of a social science question, do those have like this, they clearly must have some sort of lasting effect that's still shaping discourse, right? It seems to me. Anyway, I've been thinking about this for a while because the lab leak stuff does seem to be, you'll never be able to prove it, but it seems, like it's pretty plausible.
It's very plausible. I think it's extremely likely that it leaked from the lab. I don't think we were funding necessarily this particular research, but we were funding adjacent research on other coronaviruses. And so I think it's extremely likely that that's what happened. And look, I think you're right about the political factors at the time. I think you've summarized them well. We're now 5 years on. And you know, academic communities are supposed to work on the basis of checking and peer review and so on. And it's not like this is not important, because gain-of-function research continues to go on. There are more labs being built in various places. There are 5 labs being built in India now to do this kind of research. It's going on in Boston and New York and elsewhere, often in large cities, you know, where viruses can spread quickly. And Wuhan itself is a large city. So that itself needs debate and discussion. And, you know, again, there are plenty of scientists who have been skeptical about gain-of-function research. Very prominent scientists who have criticized this research suggest that nothing positive has ever come from it. But this is not the first manipulated virus, if that's what happened, to leak from a lab. It's happened many times before. And in fact, in 2017 in the UK, there was a conference on future pandemics. And one of the questions that was considered is, what's the most likely lab in the world where a future pandemic might leak from? And it was the Wuhan Institute that was identified in 2017. Ebright sent us the documentation on that. He was at the meeting. So this is, and the research is still going on. So it's a matter of urgent importance, not just kind of historical, you know, getting historical record correct. And anyway, at the time, I think, you know, you have a point there, a distraction, right? Bad for international harmony is what Francis Collins said. The WHO was wrong about lots of things back then. I mean, they sent this group to Wuhan. They spent like 7 days there, and then they came back and simply endorsed the Chinese strategy for every country in the world, without considering the massive, you know, security apparatus and so on that was available to the Chinese, and coercive measures that were available to the Chinese. So that itself is quite astonishing. But we need more open debate about this now, and more open inquiry, you know, from universities and from publishers.
That was Dave McBride, if you didn't guess the last question.
We have a question from Matt Rohall, who was an editor and viewing on Zoom. And I will read his question. Why should we think the negative effects from NPIs aren't more so negative effects from the pandemic in general? If major natural disasters have disruptive effects on society, shouldn't we expect normal life to be disrupted, that we will be deeply affected one way or another from school openings versus closures, masks versus non-masks, etc.?
We devote time in the book to disentangling the effects of the pandemic itself from the pandemic response as best we can. I mean, there's obviously simultaneity there, and so you recognize the complexity. One way in which you can see it is that unemployment, there's a huge surge in unemployment, which starts with the lockdowns. It didn't begin before that. The other 20th century pandemics did not feature large surges in unemployment. And unemployment goes higher in states that have more stringent restrictions than in states with less stringent restrictions. You also see economic recovery happening faster in states that reopen. So that's suggesting that the measures are having an effect. I think it was a convenient view that many well-off people, you know, economists, took during the pandemic, which is that there's no trade-offs here, you know, and that the best thing that we can do is to stop the virus, and if we do that, then we'll be better off economically as well as in public health terms. Instead of acknowledging, which, you know, is a core view in economics generally, is that there is a such thing as human scarcity, and that there are limits in how much we can do of limited resources, and that these measures were enormously costly in economic terms as well as in societal terms, and that people's behavior varied based on their life circumstances. People who were more able to stay home could do so regardless of whether they were receiving government benefits, but a large share of the workforce, which Steve discussed, could never stay home. And so, you know, there are obvious class biases here in terms of how people can respond. Those who are less afraid, young people, people who are having to work for their jobs already, they're going to restrict their personal lives less because they recognize that they're already subjected to high levels of risk. So there needed to be an appreciation of the different views that people would have towards risk, and that not to assume that everyone viewed it the same way as the knowledge workers who were able to stay home comfortably. But those were the folks who were making those early pronouncements that there's no trade-offs here, that there's nothing to, there's no reason to be concerned about the potential trade-offs here. That was the initial attitude. We'd look in the book at some surveys of economists that more or less say, that they had no concerns about trade-offs because people would stay home regardless. Whereas we see that different populations, based on their life circumstances, their age, their economic circumstances, they viewed the risk differently, and increasingly so over the course of the crisis. So the way people felt in March 2020 is not how they felt in August 2020. And so, but meanwhile, closures are still in place in some places and not in others. And so I think it's exculpatory. People want to believe that there weren't negative consequences of the policy decisions that were made. And so I think we should resist that, and we have to look at it empirically rather than just sort of casually assuming, well, people were afraid, they would have done exactly what they did anyway, when I think it's very problematic to make those assumptions.
I mean, Sweden never closed its schools for kids under 16. They relied much more on voluntary measures, which was the alternative view, and they did not have the learning losses or economic losses that other countries had. So we have comparisons we can make. And they were condemned as pursuing a crazy course, and scientists were sure that they would wind up much worse off than their neighbors, and that's just not true. They had good COVID outcomes. By some of the best measures, they did the best of any country in Europe on COVID mortality, not just the lack of detriments from these other policies.
Yeah, that Italian study that I showed you the data from in the course of the presentation, they find that Sweden did the best in Europe of all the countries, in terms of lowest excess mortality, less than places that had multiple lockdowns.
The head of the Swedish Public Health Agency, Anders Tegnell, who apparently was a pivotal person here, has published a book in German, apparently, I've heard, which could be quite interesting to look at. He played a pivotal role, and there's a very good book about the Swedish experience called The Herd by Johan Anderberg, who's a journalist, and it's quite a readable, nice account. But anyway, just a note that.
Thank you for the tip. We're researching it now.
So I have a question about, you looked at the rates of deaths, but did you look at the rates of long COVID or effects of COVID using these masks and social isolation methods? Was it useful for that?
For deaths? Sorry.
For long COVID and for other COVID, like non-death outcomes.
So hospitalizations, but other health outcomes
Health
other
outcomes,
than deaths.
yes.
That's a tricky one. We have a short section on long COVID, which we added, kind of at the end. It's very poorly understood. We talk about the evidence that is available. Viruses tend to have sequelae, side effects. It's not unusual. Other conditions are associated with it which persist. And the rates associated with COVID are apparently not higher than that associated with other viruses. Many of the symptoms associated with long COVID are similar to those that people have, and the parts of the population that seem to be most affected by long COVID, at least as reported, are not generally vulnerable to the health effects of this virus. They're healthy parts of the population. But so long COVID is poorly understood. So that's as far as that goes. We did find that with the masks and so on, and this is something that's been pointed out to us by critics, but we're aware of it, the flu and the RSV virus were reduced greatly. Now, that has been cited by evidence someone's writing against us in the Boston Review or responding to, that these measures must have worked because, the flu disappeared, and so did RSV. But, that sort of thing has been studied before, and one theory about that is that there can be viral interference on the part of a novel virus that seems to crowd out other seasonal viruses, and that's one theory of that. So it may not have been that the NPIs were effective, even at reducing the seasonal flu, but rather it was this interference effect, which I just provided a couple of citations in our response to the Boston Review pieces. So we just don't have a lot of good data on that. And the reports that have argued that the NPIs worked, including a Royal Society report that was August 2023 and 2024 maybe in the UK, only cites transmission data, not anything about either hospitalizations or mortality. So it's very strange that those who are arguing that the NPIs are effective seem to only cite transmission data, not hospitalizations or deaths.
Well, that's because there are a number of studies that show reductions in transmission associated with these non-pharmaceutical interventions. That there is evidence there that the Lancet piece that I cited from the 50 states, they do find an effect of these closures on transmission, on COVID rates, case rates, but not on mortality. And so there is that discrepancy in the literature. One possible explanation is that it just matters greatly who catches COVID, and that there's it's only certain parts of the population that were highly vulnerable, and those are parts of the population that could never be isolated. Frail elderly people they need help, and they had to have help all through the pandemic, whether it was in nursing homes or rehabilitation centers, or just in the community, family helping them. But because of that, they could not isolate themselves. So even if the rest of society's locked down, they're not protected. We can think about the misallocation of resources. Like if we had sort of acknowledged that some parts of the population were much more vulnerable than others, we could have concentrated testing resources more on nursing homes. They didn't have nearly the level of testing that college students had. I think if we go back and look at the per capita frequency of COVID tests, would be more on people aged under 25 but there was not an acknowledgement of that reality. But regardless, I think the reason why the studies focus on transmission, for the studies that want to show an effective of the non-pharmaceutical interventions, is because you can find an effect on transmission, but you're not able to find it either across the US 50 states as well as across countries cross-nationally, a relationship between the use of NPIs and a reduction in mortality. So those studies are just, there's not very many. And even, it was interesting, like even when they do report these results, they tend to be a little buried. Like when I showed you the data out of the Lancet piece and the Lancet Regional Health Europe, okay, that's middle of the piece, not in the abstract. Treated as sort of kind of like not the headline. In my view, it's kind of a headline. That we took all these actions and we can't find an effect on the outcome that we cared about the most, lives saved, and also we're most capable of measuring. We all know that with cases, we missed many of them because a lot of people did not have symptoms, or they had symptoms that were so mild they never got tested. So we know there's a lot of error in our ability to track cases. There was also the problem of test availability. Early in the pandemic, couldn't get tests. Unless you were really sick, you couldn't get tested. And so there's a lot of reason to doubt the quality of those data, whereas death is at least a little bit more clear-cut. Now, there is the problem of deaths with COVID versus of COVID, but we tended to count it in a pretty generous way. Like if there was any reason to think COVID contributed, then we counted it as a COVID death. So I think the death data is it's the most solid data we've got, and we don't find a relationship between these measures and COVID mortality or excess deaths during the pandemic.
And we might add that it's consequential another way as well, because an alternative strategy that was proposed by people that dissented from the strategies they had was focusing protection on the vulnerable. You know, that recognizing, which we knew very early on, that there was this tremendous age gradient with respect to vulnerability to COVID. And an alternative strategy would have been to focus testing, other protective measures on nursing homes and vulnerable parts of the population. That was what Bhattacharya and others were advocating. It wouldn't have been easy because, you know, care workers would have to be tested very regularly and so on, but we did have some testing capacity. So that should have been discussed and debated. Some people think it was not plausible that we could have done that, but it certainly was worth debating. And as Francis said, we did a lot of testing of those parts of the population who were pretty at low risk from COVID, namely college students.
Okay. Well, I will say thank you on behalf of all of us and everybody who's joined by YouTube. As the one who closed these doors in March of 2020, I will say this was a really hard and humbling manuscript to read, and an absolutely essential and important book for us to publish. That viewpoint diversity that you speak of is just what we should be doing. So thank you for entrusting it to us and teaching us how to do things differently.
Thank you very much. Thank you.